Hey everyone, what's up? This is Dr. Charlie Johnson, physical therapist. Appreciate you checking out my channel and watching as I interview a very special guest, Scott. Scott, where are you from, by the way?
Long Beach, California.
Potty Too Far, California, Long Beach, California. Who is a member of my Glute Relief Accelerator program and has had a really cool transformation. Went from being a little bit like, hey, I wonder if this will be valuable, before we actually decided to join the program to now I think understanding just the intrinsic value and knowing and having access to that which we've sort of provided and given inside the program. And so really great to have you here, man. And I think your story will inspire a lot of people. So thank you for being willing to share your story, and thank you for being here.
Thank you very much. It's
No
been
problem.
a great program.
Awesome, man. Yeah, so if it's cool, I'm going to ask you a couple of questions just so we can get a flavor for like what you were dealing with, and then let's walk through a little bit of the process you went through, man, to get from where you were to where you are now. All right?
Okay.
Cool.
Sounds
So yeah, what Scott, before you joined program, right? What were you dealing with as far as like where were you feeling pain, and then how long were you dealing with pain too? Let's talk about a little of the history there.
okay. Well, as far as the acute pain started the end of March and beginning of April, over exercising and picking up my 14-year-old granddaughter, and caused me severe back problems and on my rowing machine. And then I went on vacation, I couldn't pick up anything, could barely move, but walking helped, and going and down in Cancun, the warm waters helped and whatnot. But I came back after a week and still in a lot of pain. So started going to chiropractor. And after the fourth visit, it was still too much pain. So on recommendation, went to the doctor and got a shot in my butt that blocked the pain and helped me heal. And excuse me, let me shut that off. And within 2 hours, I couldn't walk. I had nerve pain down my leg. I was cramping. The nerves were causing my legs to cramp, and I was basically immobile for a couple weeks, and started with the Advil, and then went back to the doctor, and the doctor said, "Oh my God, you need an MRI."
Yep.
So went and got the MRI, showed the arthritis in a couple of discs and the herniated disc, and then it took about a couple weeks basically to get into the spine doctor. He says, "Well, you got to go back to pain management. We'll give you another shot." And I'm like, "I ain't taking no more shots."
Yeah.
And he says, "But then you can start physical therapy. And then after physical therapy, if this should reabsorb back into your system, the herniated disc, and you should be okay. But if not, then we'll do surgery."
Yep.
And I said, "Wow, the spine doctor is telling me that I can heal."
Yep.
Meantime, I'm on gummies and 1,800 milligrams of Advil, and didn't want to do anything more serious. And I go, if I can heal, and I'm supposed to heal on my own, what do I need all these shots for and interventions for?
Yep.
So then I found you on the internet. Of course, I found many places that said, "Well, do this for your back and do that," and everything caused acute problems. So I found that, a lot of it was, I had a physical injury. So of course, going through your process, I came up with like 52% physical, 48%
mind. Yeah.
mind. And I go, okay, well, I'm going to apply the pain issues to the whole thing.
Yep.
But so I joined the program of yours, and I said, I bet I'm going to heal on my own. But then I still couldn't move very well. I was in a lot of pain. And I think the first thing was the tweaks.
Yep.
I started with my tweaks, and I was able to go up the stairs in basically an L shape. Learn to the right was the only way I could move. Otherwise, my wife was pushing me up using my butt, and I was in extreme pain.
Okay.
and I still get big flare-ups. So I found a motion going through yuckies and yummies,
Yep.
and found that I could move to the left about 2 inches and it didn't hurt.
Yep.
So I started doing that exercise 3 times a day, 3 sets, until I could go a little bit further and a little bit further. Then I started doing leg lifts, and I go, well, I'm on all this pain pills. I don't know if it's hurting or what's yucky or what's yummy.
Yeah.
I'm going to cut out the Advil. And so it was a process of, okay, gummies for a little bit, now Advil for a little bit, now nothing. And yet I continued my motions.
Mm-hmm.
And I'd say about a week and a half, of course, trying to go through every motion you had, which was me being the overachiever instead of just being happy with one. I had to get down on the floor and realize I couldn't get back up, trying some different positions. And I forget it. I had to start all over. And so I started meditating and releasing. And like about 3 days after that, I just trusted in my body to heal and take care of itself.
Yep.
And find its own pathways, as opposed to trying to make new pathways physically, like I'm going to do this and I'm going to get, conquer this or conquer that. And I think that was the light bulb. It was just like the pain just went out of my body.
Yep.
I was able to stand. I had a couple flare-ups, had some nerve damage left over, I guess you could call it. But
sure.
I realized it wasn't pain. It was just the body saying, be careful, don't go too fast, idiot. And that I just trusted in my body doing the healing and letting me know when to go, when not to, and keeping the yummy stuff going. And after a bit, I was able to walk, and from walking like lurch, walking down the street, to moving my hips forward, my chest up, my chin up, getting to the corner, around the block, just little things. Pretty soon, after that, I tried getting on my bicycle trainer, and I did 8 to 10 minutes, and it didn't hurt.
Yep.
And so then I went for 15 minutes, and then I went for 20. Then I said, I can't take being inside anymore after 3 months of this stuff. So I got on my bicycle and rode 10 miles. And I feel okay, but I was like, oh, very ginger. Then I rode 15, and then I've been doing 30 miles every week until I got COVID.
Yep.
But I was doing about 60 miles a week, and found that some things still didn't work too well. I'd get in the swimming pool. I was a swimmer my whole life.
Yep.
Figuring swimming was always great for my back.
Mm-hmm.
No, I couldn't even float in the pool without causing flare-ups.
Mm-hmm.
But the bicycle was no problem, hunched over in a weird position.
Yep.
And so I stayed out of the pool, then tried, just a couple weeks ago, I did 40 laps in the pool because it was not hurting. It just started to flare up a little bit at the end of the day. Well, the next day I was flared up all over again.
Yep.
So I let that subside, went back to yummy motions, and we had a call, and you gave me some exercises to do on the ball and at the gym, and I did that a couple of times, and that really helped strengthen the back a little bit.
Yep.
And I've gotten away from a lot of it because I've been doing so well.
Yep. Cool, man. So just to recap here, right? So you'd had back stuff on and off for many, many years, ever since I think you were much younger, right? At one point, I think someone was going to fuse your spine, right?
Right.
Yeah. So since you were 5.
Right.
Wow. Okay. Didn't get the spine fused, right? But dealt with these back problems on and off. And then like March of this year, so it's now at the time of recording this, August, right? So I don't know, maybe you were 4 months into, you did this thing, hurt your back, right? Got a little bit of the runaround, it sounds like to me, right? Got the shot, did this, you got this, you go here, do this. And, when that one surgeon said, hey, you realize that most people do really well and can solve this naturally, it kind of made you say, are you telling me that maybe I could fix this without having to do all that stuff? Right. In which case you found us online, right? you obviously saw that this was like a specialty of ours. Now, let me ask you this: like, what made you reach out to me versus like you could have? I know at the time of the initial call with us, I think you had like a shot in a couple weeks if you wanted, and then a PT locally that you could have gone to. So, what made you decide? Hey, I really think I want to work with Charlie here.
I would believe that it was more natural, and I think the biggest thing that stands out in my mind is one of the things you said. Look, you can do this exercise 3 times a day, so many times a week, and that'll give you 56 treatments for a week, or you can go to a PT once a week.
Yep, yep,
I'm like, oh, the repetitiveness, and I don't have to travel. I don't have to have my sister-in-law pick me up, drag me into the car with my cane,
yep,
and go through all that pain and re-injure everything, only to find out they did something wrong to me.
yeah,
I'm my own gauge, not them.
yeah,
So when I started realizing the subtraction, not going to acupuncture anymore when she would massage the nerve
yep,
and then give me the acupuncture, I was in tears trying to get back in the car. I couldn't flip and move. And I
yeah,
go,
yeah.
point of this, when I can just get rid of all this and find what works and let the brain take over.
Yeah, cool. So yeah, basically what you saw is that I make the case for people treating themselves more effectively than others, just because if you think about it logically, right? If you see one PT, 3 times a week for 30 minutes, let's call that one intervention. Well, that's 3 treatments or chances of getting better in a week. But if you can find what works for you, then you can treat yourself every hour if you want at a
Right.
certain number of reps and not only that, but you can actually tune in to find what feels best for you versus a lot of us have been kind of groomed into a sort of a I don't know world where well they're the doctor, and so how am I going to know what to do? But at the end of the day, like you're the only one who knows what you're feeling, and you probably know better than I do, right? And
Right.
so I like to tap into that by giving people the tools, knowledge, and understanding to start to sort that out.
Correct. Correct.
Yeah, would you say that belief system is stopping many people? That belief system of I've got to go somewhere, they're the person who knows best, they're going to fix me. Would you say is something that hinders a lot of people?
Oh yeah, tremendously so. Even myself, and I think going to the chiropractor. I mean, here I could show him my MRI and everything, and he's just jumping on me or reached up behind me as I walked in the door and gave me a big hug and cracked my whole back.
Yeah, yeah,
I'm like, I don't know if that was so good for what my issues are.
yeah.
You know? And he did. I did feel good for 2 or 3 hours, and then I was a mess
Hmm.
the next few days.
Yeah. What do you think? So, what do you think was the difference there? So, you go to other people, and this I see this all the time, Scott, where it's you go to PT, you go to chiro, you go to acupuncture, and sometimes they make you worse in the moment, but a lot of times you get a temporary high, a temporary relief, right? We're like, woohoo! What? Why does that happen? Do you think? And how were we able to kind of help give you that carryover so that that didn't happen and you got long term results?
I believe I think somewhere in the material you gave me, there's a car scenario,
Hmm.
and people go in and say, "Oh, your radiator's leaking. We'll put in a new radiator," and then they think everything's operating fine. Well, there's neural pathways that come from that radiator that are the things that are the problem, not the radiator. So
Ah,
the doctors will go in and try and fix the radiator, put a cage on your spine, or do this type of scenario, but they have no clue because guess what? They're not trained in pain.
yeah, yeah.
They don't know. They only see the effect of your symptom, and they're trying to treat the symptoms and not what the connections are.
Yeah, very good. Okay, cool. And so would you say that was a big difference between, you going locally to Cairo or even the other PTs, right? What would you say is like one of the big things that really set sort of the program apart that allows you to now step back on the other side? Maybe in the beginning you didn't know before you decided to be a part of it, but now you can maybe say, wow, that was like really valuable. And a lot of people are really missing this stuff.
Yeah, I think the community through your school, your GRA program, really helps normalize where people are at, and a lot of active people trying to get back to being active,
Yep.
and seeing what their roadblocks were, and you go, huh, I don't have to go down that roadblock. Um,
Yep.
I often thought of change with meditation or personal change, people can choose to go one step at a time up a stairs to the second story, or you can just picture yourself on the second story and not
Yeah.
stairs in between.
Yeah,
And
very nice.
And you don't have to do that. You know, you find a couple things that work, and then let the process take over. And I have a physical problem, and yet I treated the pain all the same, even though, you know, there were times when I was 5 years old. I remember I was crawling on the floor.
Yeah.
I couldn't stand up. I was too much pain.
Yep.
Cool. I had found ways to exist up until I'm almost 70 now.
Yep.
But I caused myself some physical pain, but the old mental, I wouldn't say problems, but the old pathways triggered at the same time.
Yep.
Oh, this is what you gotta do. You gotta rest. You gotta stay in bed, you know? And I was like, oh, I gotta move my leg. I gotta do a couple leg lifts, you know, and I gotta do a little bit of the, and you do work at it, and it is a process to know, but you can't go too fast and do, you know, leg lifts with 400 pounds on.
Yep. Yeah. So let me ask you this, right? Was this a process where, you know, you came in and I said, hey man, here's your sheet of exercises, just go home and do these and see what happens?
No, no. This was a mental process, not a physical process. And it was seeing all the other avenues. I wanted to get to the sheet at the end and go through all the exercises to make myself better, the cause and effect type thing. Yeah, I'm going to go through this. In fact, I think Tracy sent me a thing when I was doing my yummy and yucky exercises. And I said, I can't get to number 3, 4, and 5, and 6. And she said, Scott, you only have to find one. and I go, oh, okay, that's simple.
Yeah.
One, and the rest was reading and meditating and a little bit of rest, but letting the body, knowing the body was safe. I think the other thing is fear. You know, it's just like, if I'm going to move this way, it's going to hurt and I'm going to cause that pain. So I said, I'm not afraid, my body's safe. And that was a big message to myself.
Cool. Yeah. So what I hear is, in the beginning, like most people, you come in, you're like, I'll do whatever you tell me. I want to get better as fast as possible. So you tried to crush it, meaning literally you tried to go through everything as quickly as possible. You were doing all kinds of exercises. Then Tracy, client success coach, so we have other people who have actually gone through the program who can help you as well, along with me, said, hey, Scott, what are you doing? Right? And you said, well, I'm trying to do this. And she said, no, less is more. The goal is to help you find one motion, right, that reduces your symptoms and feels, keyword, safe, yummy. And so less is more, one thing, right? The second thing is that you use yummy motions. I heard this reoccurring theme as you're chatting. You use yummy motions, and what you could do and the focus mentally on that versus focusing on what you can't do and all these motions hurt and let me do yucky things that hurt so good. You leaned into yummy to fix yucky.
Exactly. And I think the spreadsheet that you have is excellent, even though I didn't like log into it every week and stay on top of it, because mentally I grasped where I was going and didn't have to do that type of work. Although some people, but your thing of making it a scientific process of eliminating and adding really is key, because you're not just going, well, I can't walk and I can't go upstairs. No, but I can sit here and do a leg lift. So that's all I did was a leg lift, or I could just slide to the left, not what I couldn't do. And I saw that on the chart. Oh, I can't do this. Everything's yucky. Oh, there's one yummy thing. So it became a scientific result oriented basis, which became very appealing to continue. And mentally, I just grasped it right away. Yeah.
And I would actually say it too. So the interesting thing for your case is that you definitely had like this physical structural stuff going on, right? You lifted up the grandkid, right? You did this, you did that, can't move, can't whatever, right? And MRI shows, some stuff, which is probably normal for where you're at, but still some disc stuff, some other stuff, right? And yet you still really found value in some of the, strategies as it relates to the brain in pain and reprogramming your mind or your reaction to pain, useful. And I think that's valuable for a lot of people to hear, because sometimes people reach out to me and they watch my stuff and they're like, but I don't have that. And so they very quickly think that they know something, right? Or that they have a fixed belief about something. And so they bypass all that and they poo-poo it. And they say, you know what, that brain stuff, that meditation stuff, if done in the wrong way, you're right, can make you worse. But if you understand why you're doing what you're doing, and you understand the way that these neural pathways can become trained and how they play into very physical pain that you experience, it's not woo-woo. And so what could you say to someone who's watching? It's like, man, it sounds like it's talking about that brain again. And my problem's a disc. I know it is. Forget about that. He can't help.
Well, you talked about it in the neural pathways, and some of the words that we use to describe things are actually negative for us. So, because you're saying reprogram the brain. Well, you're not a friggin' computer.
Yeah.
You can't go in and wipe the slate clean and physically change the neural pathways. You have to relax and let it happen organically, so to speak.
Yeah.
And it will. And if you're feeling pains, then just identify with what it is. That you're finding these old pathways, and your brain's going to regress because that's what it's used to. That's what it wants. That's where its comfort level is, so to speak.
Yep, totally. Yeah, awesome, man. And so it works. You could vouch that it works, correct?
Absolutely.
Yeah. Cool. Now, when you chatted with us originally, you left the initial call with us, all right, where we chatted about sort of the process and all this. And it was kind of, I think, one of those things where you had to think about it, right? You're like, I need to think about this, right? And so, like, if I can ask, think back to that, if you remember, like,
Right.
what was kind of stopping you? What was like, was it, I don't know, what was it, man?
Excuse me. I would say it triggered myself to say, can I do this? This is a lot of work, but it also appealed to why am I in so much pain when it shouldn't be this much pain?
Yeah.
Why is my body reacting like it is? And I think just, having gone to acupuncture and getting worse and getting no relief from anything, and the amount of pain pills I was taking, and the ideas of more shots and more, it's just like, there's got to be a better way. So I kind of trusted in the process. I had looked at all your different videos. I'd looked at a lot of guys' different videos. One guy from England for guys over 55, how to behave, and two other guys that were, well, let's do this type of exercise. And I said, no, those are not helping.
Yeah.
They're too, how am I going to find someone on the internet? And obviously my chiropractor, and I found Charlie Johnson on the internet, but I'd say there was a process. And I think the process and breaking it down and understanding whether it was physical or mental, you definitely had the keys to the shed.
Yeah.
So
and the goal for me, right, is somebody who studied almost all these physical approaches, and then also all the mental approaches, if you want to call them that, right, the psychological side of things, is to leave no stone unturned. So,
right.
My question for you would be, hey, do you think that it's possible that someone could come into this program? Maybe they're worried about it not working, or maybe they're wondering if there's a way out of this stuff, right? Do you think it's possible that somebody could go through this if they commit a little bit of time, right, and energy, of course, and some money, to get no value out of it? Like it won't work.
No, impossible. I think that if you gain 5% out of this, it's worth every, forget the money, but forget the time. Because now you've become your own doctor and you're starting to heal. Why would someone not be happy with the process? It's just because they're so inundated by doctors and the automobile type uh, scenario that I painted.
Yep. Yeah. Yeah. So just to be clear, you can use these concepts, the principles inside the program that we teach you, to also treat other things than just pain in the butt, back, leg, hips, all that.
Oh yeah, absolutely,
Yeah.
absolutely.
Yeah, really cool stuff. It's transferable. And so we're trying to teach you these life skills almost, if you think about it, so you can handle other aches and pains. And are you also saying that people are a little bit resistant to the body and brain approach?
Oh yeah, oh definitely. Even when they have done a certain amount of meditation and whatnot, we're a Western society,
Yeah.
and we look for, you know, how many thousands of chiropractors or doctors, and none of them have, you know, they're just trying to release symptoms and not looking at the effects, and they're making money. They've got to make a living.
Mhm.
I mean, you've got to make a living by doing this, but it's not, and you've reached thousands and thousands of people, which is phenomenal.
Yeah.
It's a best way. But you put out a hell of a lot of free videos on your YouTube.
Yeah.
You know, people can start to maybe even use those. So,
Yep.
but if you want to fine tune it, then you go to your meetings.
Yep. Totally. Cool, man. And so the difference between this approach and other approaches, if you could summarize it in like a sentence or two, what would you say is the difference between this and mainstream stuff?
God, a mechanic can fix your car, but no one can do your own brain. Even when you go to a psychiatrist, they
Yep.
they only give you what you're giving out, and then you make the changes.
Yeah. Good. Okay. I really like that. You know why? Because I tell us people all the time, you know, they here's the thing, they got to get knocked on their butt enough. So if you're watching this, you've tried lots of different things, you may not be at the point where you're open to a different approach. If you are, we'd love the chance to potentially help you. But lots of people, they're here standing in front of this mirror. They don't like what they see or what they're getting, the results. And so what do? They try to change the mirror. They try to change the treatment. Well, I'll go to the chiro. That doesn't work. Maybe the orthopedic doc, maybe the shot, maybe the this, maybe that. You've seen it. You've been involved in it, right? Versus being like, you know what? I don't like what I'm getting. What if I change myself?
Right.
Then I change the outcome. And so I'm really teaching people how to heal from within by using the power of their mind and their body versus feeling like that person's got to fix me.
Yep.
No.
Absolutely. Absolutely. And there's just so much trust that they can put in someone like you that wears a hat like that. I mean, there's just,
Well, I mean,
it,
why
there's
wouldn't it?
about it that outdoes a doctor. It's 10 to 1.
Should I get my lab coat? I think I have my lab coat over here. Would that look better?
Yeah, maybe so. Maybe so.
Good
Well,
stuff, man.
or if you just did the video with your stairs to nowhere.
Yeah, they're at the other house. I'm actually at my mother and father-in-law's right now. So yeah. Cool, man. All right. So would you recommend the program at the end of the day?
Yes, I'd highly recommend it, even if you got a 5% return on it, because you're starting on doing your own schooling.
Yep.
As opposed to have to go out elsewhere.
Yep. Totally. Cool, man. Awesome. So, hey, Sky, I appreciate you sharing the story, man. I think that's a wrap, right? Got an idea of where Scott started, back pain since 5, but then, you know, kind of threw his back out or hurt himself in March. Took several months before he joined the program, before he really started to stop relying on other people and said, hey, I can maybe learn how to do this. And there's somebody who can maybe teach me. And the answer is absolutely yes. So if you're watching this and you're like, hey, Charlie, you're a PT, like, aren't you going to fix me? Well, we could, but it would be temporary relief. And so we can teach you how to treat yourself. And just like Scott did, the cool thing is that once you own these tools, you can use them to help other people. You can use them in the future if things flare up. God forbid you have some other ache or pain that pops up. And you're really starting the process of being self-sustainable long-term as it relates to being a human and having a pain experience and understanding what needs to happen to rid yourself of this. Okay. So we feel a full conviction that we can help with many cases, but of course, the best first step is to always submit a case, apply to work with us if you're interested, because I don't believe it's ethical to work with anybody who I don't feel confident we can help. Okay. So again, if you're watching this and you're looking for an outside the box approach like Scott, then I would say, hey, click the link below, somewhere below this video, or maybe in this video, wherever I can put it. It is a link to apply. It'll take you to the call calendar. This is exactly what Scott did. You will be prompted to review a pre-call packet and submit a case review. Bunch of different questions, gives me all the details I need to verify that I can help before we even chat. There is no cost to the call. It's simply to see if we can help and hash some things out and chat through the process. If I feel like we can't help, we'll just tell you. And heck, I'll even give you a call after I review the case, as long as you're local, like I did to Scott, and say, hey man, here's what we're doing. Here's what to expect. And hopefully we get the chance to help you out. So Scott, any final words, man?
No, I think being able to watch you spread the word through YouTube to so many people that don't know how to deal with pain. It's nice to be able to spread this type of positive pain relief program.
Well, you know, man, I have big plans in the future, right? As far as development of some different things, some software, some things like that. The thing that keeps me going is knowing that I'm helping lots of different people. Obviously, we don't help everybody in the sense of maybe 100% pain-free, but I do, with full conviction, believe that we do help everybody in the sense that there is no way you can go through this process and not walk away a more informed human being, right? And so I think that's really valuable. And so I appreciate you helping me spread the word. And again, if anybody's watching this, or you know, if you're here and you're wondering like, hey, is there a possibility that you know, I could solve this problem after so many years of being stuck in pain, whether it's something that's very physical with the body, or something with you know, maybe have some stress involved or other things going on in life. I would absolutely love the chance to help you out. No pressure, but you can click the link below to apply, chat with us, and submit your case for review.